Yeah, the whole experience. You know what I mean. Being part of that infection. It wasn't all that great, was it?
Nah, the whole thing, right from the source, it stunk, so to speak.
The host, though. She was terrific.
Oh.
I loved her from the moment we arrived.
Yeah, she was beautiful, wasn't she?
You gotta admit, the way we was transmitted was pretty clever.
Yeah, real clever.
If we could hear two germs talking, this might be what we'd hear. Obviously, in the real world, germs are not cute characters. They can cause infections, and concern over infections has never been higher. Since the AIDS epidemic and the emergence of multiple drug-resistant organisms, we have all become even more aware of the dangerous presence of bacteria and viruses that surround us. If you work in a healthcare setting, you have a need to know about and take precautions to prevent infections, even if your job doesn't involve direct contact with patients or residents. Germs live and grow everywhere in our environment. They're too small to see with the naked eye, but they're everywhere, on every surface we touch, on our bodies, in food, water, soil, and in the air we breathe. Some germs are helpful to our bodies, and most of the time, people and germs get along well and live together without a problem. But when certain germs get where they don't normally belong, they can become harmful and capable of causing infection. When germs produce infection, they are called pathogens. Well, just how is it that these infections occur? Healthcare facilities are close quarters for a lot of different germs that are in the air, on patients, families, visitors, equipment, or employees. Some treatments and procedures that we use can increase our patients' chances of getting an infection. For example, tubes that are inserted into the body, such as an IV, Foley, or breathing tube, provide a pathway for germs to enter the body. Some surgical procedures cut open the skin, which is the body's most important defense against infection. Drugs such as steroids or cancer drugs lower the body's resistance to infection too. The overuse and misuse of antibiotics has created stronger types of bacteria that are very resistant to the antibiotics that we now have available.
So, who's next? We can't go back to that school. They're using a new cleanser in the bathrooms. I don't even want to think about it.
Yeah. Hey, have you ever tried a healthcare setting? Oh, now there's a bunch of good hosts.
Wait a minute, a healthcare setting? You mean like hospitals and nursing homes?
Yeah, and clinics and like that. There are lots of patients or residents in those places that are more at risk and easier to invade.
Those patients or residents are more at risk because their resistance is already low. They include newborn babies, especially premature ones, elderly, seriously ill persons, people who have poor nutrition, people with some illnesses, such as diabetes, cancer, or AIDS, and persons who have had surgery. There are a lot of other people who can also become infected, like visitors, volunteers, nurses, therapists, and virtually all healthcare workers. If someone gets an infection as a result of being a patient or resident in any type of healthcare facility, we call it a nosocomial infection. These infections can include such things as urinary tract infections, bloodstream infections, pneumonias, surgical infections, foodborne illnesses, hepatitis B, and AIDS. It is estimated that about 1 in every 20 patients or residents admitted to a healthcare facility gets an infection. That's 5% of patients. Nosocomial infections are a concern for several reasons. They can lengthen a patient's hospital stay, increase medical costs, affect a patient's mental well-being, cause pain, added suffering, and even death. It is estimated that 1% of patients or residents who get a nosocomial infection will die as a direct result of the infection. And in another 3%, the infection is a major contributing factor to death. This amounts to about 80,000 deaths every year. In terms of dollars, nosocomial infections are estimated to cost between $5 and $10 million a year in this country, and are a severe financial drain on healthcare facilities. The purpose of infection control is to prevent these nosocomial infections among patients, staff, and visitors. Quite simply, we must prevent the spread of germs. To be able to do this, you must first understand how infections are spread. For organisms to spread disease, they must grow, reproduce, and move from one place to another. The spread of infection, more commonly known as the chain of infection, requires 6 links. First is a microorganism, or a germ, that can cause disease. Next is an infected person, someone like a patient or healthcare worker who is carrying the germ. Third is a way out of the person, such as coughing, sneezing, or laughing. Fourth is a method of transmission or traveling, such as through the air on droplets, or carried on dust particles, through direct physical contact, or indirect contact, such as traveling on hands, towels, or contaminated equipment. Fifth is an entryway, or a way in, such as breathing into the lungs, or entering a wound, or getting through the skin by puncturing with a needle or a sharp. Germs can also enter through the genitourinary tract, the gastrointestinal tract, the parenteral route via blood or other intravenous solutions, and also from the mother to the fetus through the placenta. Sixth in the chain is the new person who is at risk, called a susceptible host. Age, health, and other conditions present at the time of exposure are all factors in whether or not someone can resist or fight off the invading germ. What can you do as a healthcare worker to prevent the spread of germs to others or yourself? You must break this chain of infection by removing one of the links. Without the whole chain, infection cannot occur. The weakest and easiest link to remove is the fourth, the means of transmission.
A healthcare facility, huh? I don't know. I thought those places were all so sterile and clean.
Well, yeah, they are. But the people, you see, it's the people and the hands. All those hands, big hands, small hands, all great places to grow families. Heck, huge colonies of us can live on one hand. And the great thing is, we get transferred from one person to another so easily with just the touch of a hand.
Oh, I get it. Kind of like one hand infects the other, huh?
Yeah.
To prevent transmission, hand washing is one of the oldest, but still the single most important way to stop the spread of germs. Good hand washing gets rid of the germs you may have picked up from touching a person or object. When you approach the sink, avoid getting your clothing dirty or wet by touching the sink. There are many germs around the sink area. They grow and multiply fast in wet areas. The faucet handles and the inside of the sink are considered contaminated or dirty. If you wear a watch, push it up 4 to 5 inches above the wrist. Germs tend to get stuck in the irregular surfaces of jewelry, especially rings, which can harbor bacteria. Adjust the water temperature to warm. Warm water makes a better lather than cold and removes less protective oil from the skin. Hold your hands lower than the elbows. Your hands have more germs than your wrists, so the flow of water should be from cleaner to dirtier. Wet hands and several inches of forearm with water before using the soap. This will prevent chapping from frequent hand washing. Be sure to get a good lather and include your wrists. You should wash for at least 10 to 15 seconds. Certain parts of the hands, like around and under the nails and in between the fingers, are a good place for dirt. body oils, and germs to hide and grow. So pay attention to these areas. Wash using vigorous, circular movement and lots of friction. Fingers and thumbs should be interlaced to clean the spaces between the fingers. Rinse well with hands lower than the forearm and dry from the fingertips to the wrists. Always dry your hands well on paper towels. It's important to dry gently and carefully to avoid chapping. Chapped skin frequently breaks open, which allows germs to enter. Use a clean, dry towel to turn off the faucets. This way, you won't touch the dirty handles with your clean hands. If running water is not available, such as in someone's home or a mobile unit, or at med carts, and between resident contact, use disposable washcloths or waterless hand washing agents until hands can be washed properly. Germs stay under long nails, which are difficult to clean, and in cracked nail polish crevices, or along the adhesive edges of artificial nail glue. So it is best to keep fingernails short and avoid the use of fingernail polish or artificial nails. Hand washing done the right way and as often as needed may cause the hands to become dry and irritated. Using lotion after washing may help. If you have direct contact with patients, always wash your hands thoroughly when you get to work. Before and after using the restroom. Before and after blowing your nose. After covering a sneeze or combing your hair. Before and after eating, drinking, smoking, applying cosmetics, or handling food. When completing work, before going home. Before and after direct physical contact with each patient or resident. Before and after handling in-use patient care devices, such as IVs and Foleys. Before performing invasive procedures. After removing gloves or other personal protective equipment. And immediately if they become contaminated with blood or other body fluids. Never wash gloves. Hand washing is a simple, inexpensive, but effective procedure that applies to anyone in any job they do. Everyone who touches anything or anybody must always use the proper procedure. This includes those who handle food, medications, patient care equipment, and linens. Also, those who clean patient areas, transport patients, and repair patient equipment. This includes maintenance workers who perform plumbing repairs. There are other protective measures that help control infections too. All healthcare facilities where workers could possibly have contact with blood or other body fluids are required to have a system of either universal precautions or body substance isolation. Using universal precautions, or BSI, means treating the blood and body fluids of all patients as though they are infectious. With these systems, you use protective barriers such as gloves, gowns, face and eye protection to prevent any contact with the blood or other body fluids of any patient, whether the patient's diagnosis is known or not. Your facility will have specific policies on when to use these barriers. Basically, you should never touch blood or other body fluids with your bare hands. Additional precautions, however, are required for airborne diseases, such as tuberculosis, rubella, mumps, and chickenpox. The appropriate mask protection must always be worn when there is known to be or a suspicion of TB. Your facility will have specific policies and procedures to follow. There are many other protective measures you can take depending on what area you work in and what your particular job requires you to do. You should learn the specific infection hazards of your job and learn the infection control policies for your area. Large amounts of waste, linen, contaminated equipment, and supplies are handled in healthcare facilities daily. You need to follow your healthcare facility's policy when handling these items. Many federal, state, and local agencies also have rules regarding waste disposal. Waste that is designated as infectious needs to be handled in special ways.
Okay, so let me get this straight now. If they're washing their hands and they're wearing the right personal protective equipment and they're handling waste correctly, then we're in a lot of trouble. How are we supposed to get in?
I'm so glad you asked, my boy. Needles in shops and anything that can cut through those stupid gloves and skin barriers. Why, I was just talking to a cousin of mine, HIV. You've met him.
Yeah, the HIV, yeah, right. Who hasn't? He's famous. He is one dangerous cookie.
Well, we could take a lesson from him. When he couldn't get through in body fluids, he started hitching rides on needles, and he and hepatitis B's got the market cornered.
Particular attention has to be given to the handling and disposal of needles and other sharp objects. Being accidentally stuck with a used needle is probably the greatest risk the healthcare worker has for getting infected with hepatitis B or AIDS. Needles are never to be recapped, bent, broken, or cut. The Occupational Safety and Health Administration issued a set of rules that employers have to follow to protect their employees from bloodborne pathogens like hepatitis B and AIDS. You will get more detailed training on this if your particular job requires it. Each department should have written policies and procedures on infection control. It is important for you to know what your risks are. All caregivers should have regular updates on infection control. As more and more people are cross-trained to do other jobs, healthcare workers must become aware of the infection risks and proper procedures for all the areas of responsibility. Keeping yourself in good health is another way to protect yourself. This includes eating a well-balanced diet, getting enough sleep, and exercising regularly. You should also practice good personal hygiene, which includes daily bathing, wearing clean under and outer clothing, uniforms, lab coats, or smocks. Hair should be kept clean and secured if it's long. Limit your jewelry. If you see others not following proper infection control procedures, you should report it to your supervisor. Don't report to work if you are sick. You may be a source of infection to your coworkers or patients. If you have a fever, vomiting, diarrhea, unusual rash, or draining sores, stay home. You may need to seek medical care. If you become ill at work, report to your supervisor or employee health department. We are facing more and more challenges in infection control than ever before. Along with AIDS and the recurrence of tuberculosis, we are seeing an increase in childhood diseases, viruses, and many more bacteria that are resistant to the antibiotics we have.
I'm not feeling so well. All these procedures, all these precautions. I even heard the vancomycin police have been sent out. I'm getting a little scared.
Yeah, take it easy. Don't panic. I got the number of a club that's giving out free samples. We can go, get resistant to antibiotics, and we could have a whole new career. Come on, let's go. It's all the rage.
Yes, the danger of infection is always there. But remember, you can prevent or control nosocomial infections by breaking the links in the chain of infection.
Hey,
Yeah?
just think how many relatives were passed during this presentation. I love it.
It's like an all-you-can-destroy germ buffet.
I love this place. Give me a plate. Hey,
Yeah.
you got a lift home?
No, not at all.
What say we hitch a ride on that guy sitting in the second row? Come on!
You know, they say more people cough at the end of a film. They're probably coughing now.
Thank you. Thanks for attending. Thank you, ladies and germs.
Hey, watch it.
Sorry.